Hello guys, today we will talk about nephritic and nephrotic syndrome. First we will talk about nephritic syndrome, then we will talk about nephrotic syndrome. In nephritic syndrome, it is a glomerular disorder, microscopic hematuria, blood in the urine. And the second thing is mild proteinuria, protein in the urine, but in the mild amount. But in nephrotic syndrome, there is massive proteinuria. We will talk later about nephrotic syndrome, but this is common thing and the key difference. This is why I have discussed over here. But in nephrotic syndrome, there is massive proteinuria. In nephritic syndrome, there is hypertension. And fourth is edema. Fifth is oliguria. Oliguria, it means low urine, less than 500 ml per 24 hour. Hypertension and edema due to sodium and water retention. So there are 5 things in nephrotic syndrome which have to be remembered. First is the microscopic hematuria, blood in the urine, mild proteinuria, and the third is hypertension due to sodium water retention. If there will be sodium water retention, there will be more blood volume, due to which hypertension. And this blood volume will go to the tissue. This all more fluid will go to the tissues, due to which there is edema. Fourth is the edema, and the fifth one is the oliguria. In proteinuria, there is less than 3 gram per hour per 24 hour in urine. Let's talk about nephrotic syndrome. In nephrotic syndrome, we have discussed that in nephrotic syndrome there is massive proteinuria, more than 3 gram per hour per 24 hours. Hypoalbuminemia 1 to 3 gram. एल्ब्यूमिन का लेवल कम हो जाता है. एंड थर्ड इज एडिमा. एडिमा इज कॉमन इन बोथ नेफ्राइटिक एंड नेफ्रोटिक सिंड्रोम. In nephritic syndrome, edema due to sodium and water retention, whereas in nephrotic syndrome, due to hypoalbuminemia, low osmotic pressure की वजह से edema होता है. In nephrotic syndrome, in nephritic syndrome, we have discussed in nephrotic syndrome hyperlipidemia. It means more amount of lipid in the urine. And the fifth one is lipiduria. Lipiduria means lipid, more amount of lipid in blood. So we will discuss about how the more amount of lipid in blood and urine. So what happened in nephrotic syndrome? There is massive proteinuria. A patient undergo massive proteinuria, due to which a patient take from his diet. As the patient take protein more from the diet, and the second thing, patient release protein from the liver. Both of the things goes into the blood vessel and go to the kidneys. And in kidney, due to there is massive proteinuria, there is low filtration in the kidney, so there will be massive proteinuria. So what happen is that the liver produce more amount of protein to compensate. For example, liver produce lipoprotein like LDL, VLDL. So there is more lipoproteins in the blood vessels and more lipoprotein in kidney, and it will be excreted out. So there is hyperlipidemia in the urine, and whereas in blood, lipiduria. This happens because the liver try to compensate that massive proteinuria. It try to compensate our body normal protein level, but it will excrete out by the kidney. So that's why there is hyperlipidemia and lipiduria, because liver produce excess amount of protein, lipoproteins. And the sixth is coagulability. And main thing is fibrinogen will be high due to more hepatic synthesis. In biochemical test, we will see fibrinogen is high, of course, due to high hepatic synthesis. Normal albumin level is 3.5 to the 5.5 gram deciliter. Hyperlipidemia in blood and the urine. We already talked how it is hyper in the blood and the urine. क्योंकि बॉडी पहले से प्रोटीन बनाती है, लिवर के थ्रू बनाती है प्रोटीन, एंड डाइट से भी काफ़ी ज़्यादा प्रोटीन हमें मिलता है, जो कि ऐसी कंडीशन में जैसे कि नेफ्रोटिक सिंड्रोम काइंड ऑफ कंडीशंस में किडनी अच्छे से फिल्ट्रेट नहीं कर पाती है, जिसकी वजह से प्रोटीन सारा यूरिन के थ्रू बाहर निकल जाता है, क्योंकि बॉडी में बहुत कम प्रोटीन होने लग जाता है, जिसकी वजह से लिवर प्रोड्यूस करता है प्रोटीन कंपनसेट करने के लिए, उसके लेवल को नॉर्मल बनाने के लिए लिवर प्रोड्यूस करता है लिपोप्रोटीन बहुत ज़्यादा, जिसकी वजह से ब्लड में जो कि लिपोप्रोटीन का कंटेंट होता है वो बहुत ज़्यादा हो जाता है, जिसे हम बोलते हैं लिपिड्यूरिया। एंड वही क्योंकि किडनी फिल्ट्रेट नहीं कर पा रही है ढंग से, तो वो वाला प्रोटीन भी बाहर निकल जाता है, हाइपरलिपिडीमिया इन द यूरिन। थैंक यू।